Good evening, parents. Thank you so much for joining me this Wednesday evening. I hope you had a great day. I am very excited to share with you this class because I feel like it is the heart and soul of who a doula is. It's about that comfort level. It's about creating your own little cozy atmosphere wherever you are in that process of labor and delivery so that you can relax fully, that you can connect with your partner, that you too are ready after all of these conversations that we've talked about, having it with your medical provider, if that's your OB or your midwife, the conversations that you have with your nursing staff as well is very important, but that's kind of day of, and that comes into the comfort measures as well. So today's topic being that we will be talking about supportive labor positions and mental and physical relaxation. I also have a guest expert for you tonight who is Dr. Kayla Ambert, and we will learn more about her towards the end of our class. But she's going to help us really understand how we can do a lot of preparation on the front end and implementing comfort measures currently so that when the day of labor and delivery comes, your body is ready, you're aligned, that you are feeling confident with the direction and movement of your baby coming down and out and onto your chest. So with that, let's move forward and get onto some more of these slides that I always make you look at. All right, so comfort measures, as I said, looking at them, they are really, they're not that medical intervention. It's that piece of where mom wants to ask and empower herself to get her needs met, that are going to help her in more of a holistic way to get in the zone and know exactly where she wants to be mentally and physically in order to relax and release. So we're looking at things like acupuncture, aromatherapy, freedom of movement, hydration, sustenance, get that nibble on throughout that day of labor is really important. We'll talk about that. Hydrotherapy, if that's a shower or a bath, massage, therapeutic touch, and partners, you can really help with that, along with, if you do entertain the idea of a doula, lots of hands on you and supporting you with counter pressure and maybe some acupressure points, just anything to keep you solid and in the zone and focused on your own strength. And then what I really enjoy is music as well. I think the tone that's set in that room, if it's upbeat because we're trying to get energy, if it's dropping down the tone because there's too much chaos going on and we need to dim those lights and get in tune with the sound, then music can really help out. Meditation tapes as well. So next, active labor. We talked about this with Dr. Courtney Martin last week, and it's that important piece that we're trying to attain, right? We're trying to keep you home in early labor so that you can be in your own environment, around your own germs instead of a hospital. You're aware of where your restroom is and what you like about it. And you could even essential oil that whole place so it feels like a little spa, that you have access to everything that you're familiar with. Staying in early labor at home is so helpful for your comfort level. But what we're going to talk a little bit more about today is when we get to that point of knowing that we're at every 5 minutes for an hour, you're having a 1 minute contraction. When that 511 comes up, and moms, you don't have to take control of that. Partners, this is where you're going to be the individual of wisdom. You're going to watch her change. You're going to kind of understand the cadence of her body and the emotions that are going along with it. Early labor, she's having a conversation with you. You're laughing. She maybe makes cookies, watches a TV show. You're walking about, doing errands. All those kinds of things can happen in early labor. Active labor is going to be that moment where you realize life is changing and she needs your support the entire time. You cannot leave her alone, and you have to have her back, literally massaging, counter pressure, or holding her so that she feels like you can dance together and you will carry her weight, and that all she has to focus on is her mental strength and breathing through the rush and the wave of that contraction coming on, or that surge coming on, and that she will go into it and she will rise, and then she will know that it will end at that point and come back down, and she will step out of it, and you will step out of it together and breathe and know that another one will come, but that you can endure it, that you have the strength to step into it and step out of it. So, active labor. How do we create the most comfort? Well, really, we're looking at the 5 to 9 dilations. So, with that, we'll go right here. Here's something that is really key and helpful. It's that restroom usage and change of position per hour. So this is your rule, partner. You need to watch mom, be engaged with time. Mom needs to forget about time. Your job is to remind her, okay, I think it's a good time for you to use the restroom, empty that bladder, create space. Change the position, allow those hips to shift, that pelvic bone to shift, to allow that baby's head to come down gracefully. And so that that transition for mom and baby goes smoothly, we need to keep mobility of her entire body. And we'll go through some positions. Let's see. Next. I'm having a little trouble with my slides tonight. I apologize. So when it comes to positions, I like this little diagram right here. It gives you all different varieties. You can practice now. Moms, I highly recommend try all of these positions. See what you like, but also keep an open mind that the day of your labor, and especially when you dance into active labor, you will want something different, or you may like the same thing, but you might want to shift and give different guidance. So this is where I need you to use your voice. You need to engage with, okay, I am in charge. This is my show. I get to call the shots, and everyone else needs to come and help me get into these positions. If you allow somebody else to do it for you, you're not meeting your own needs. I want you to engage with, I don't like this. I need to move. I want you to feel empowered to say, I really like this. Please keep me here. I am getting a little bit numb. I am getting a little bit tired. I'm feeling too much tension here. You're going to feel a lot of tension, but you'll be able to tell what's good and what's not good. I feel like I need to move. I feel like I need to walk. Can you walk with me? Can you hand me this? These are all things that need to come out of you. And so you have to use your voice, and to know what you want is the priority. You have to know that you are the person that is going to know exactly what's going on internally, if that's mentally or physically, and no one can read your mind. So use that voice. Partners, I also urge you to just pay attention. Don't watch TV. Keep that TV off. Don't watch anything on Netflix or Hulu. This is a very special time. So if you can be in the atmosphere of engaging in stories, how you guys connected, how you created your story of your baby, and how you've gotten to this point with all of the education that you've sought out, with all of the attention to physical, mental health, nutritional health, all of that comes into play because you've been getting ready for this marathon, and it's race day, and you guys are going to connect, and you're going to understand that the connection and the pheromones are the most important things going on in your environment. People external of your relationship, and that can be mothers, fathers, in-laws, brothers, sisters, cousins, all of that. Really figure out who you want to have present on that day that is in your circle, because it's going to come down to who will relax you the most, who will engage with you to get you to understand your own strength. That will not inhibit the process of relaxing and releasing, but really understanding how you can communicate with your partner and utilize their pheromones for your own goods, as we've talked about. And you can feel comfortable having a kiss, having a nice walk and cuddling together, because that has to be nurtured. If there's going to be a person that's going to inhibit that, then think along the lines of what can be their role for the day. I really like to think if we need to have anybody else other than the two of you in the room, they must have a role. So is that they're going to bring food to you? Is that they're going to be on your text chain updating people on your progress because you have a tight-knit family that really wants to know what's going on through the day? Figure out what that person's role is going to be, but also figure out when they're going to be playing their role during your labor and delivery. And maybe that's not that they're there the entire time. Maybe it's just for 15 minutes or 20 minutes, dropping off some food or allowing dad or partner to take a nap so that partner can feel solid and awake and alert for when everybody gets on the postpartum side and step in and help out with baby now that baby's outside of the womb. These are all really important things. I absolutely adore it when a couple can really drop into their love story, that they can laugh about travel adventures that they've endured together, that they make fun of each other, that they laugh, that they feel that they can be vulnerable enough to cry because it's overwhelming. Happiness creates tears. Nerves creates tears. You have to let it all flow. I always tell moms, and sometimes it happens to dads too, but that everything internally has to come out of you. Fear, fluids, all of that has to flow out of you in order for you to release and relax and let your baby come into your arms. So with that, let's go through some positions that could really help you and your partner connect when you get into any kind of labor. When I talk about early labor and that you'll be able to have conversations, these positions are still going to be beneficial to you. Active labor is when they are going to be something that maybe you stay in for a longer amount of time because it's harder for you to get to the next position quickly with the pickup of contractions or surges that are coming up. So as you can see in this upper left-hand corner, partner is behind mom, looks like you're on the ground. Now in the hospital, please do not sit on the ground. Don't put anything on the ground, but you can do this in the hospital bed. You can also see this person right here, and this person looks like it could be your doula or your midwife talking you through the surge, letting you remind yourself that you have done this, and you will do it again, and you will take on that step into the contraction, work it up, and let it go. And they typically, when they start to pick up, are a minute long. You can do anything for a minute. Right here is pretty cute. It's water breaking. I have moms all the time that are like, I don't know, did my water break? I'm not sure. Sometimes there's a gush. Sometimes there isn't. Sometimes it happens on a toilet and you didn't realize it. But when you get to the hospital, they'll let you know. What we're really looking for in figuring out when to make that call to go to the hospital is the pickup of that contraction and the duration of it. So that it's lasting an hour, maybe 2 hours of the same repetitive pattern. We have every 5 minutes, 1 minute long contraction for an hour, okay? When your water breaks, that does not mean that you have to go to the hospital. So just keep that in mind. But it does show that you are progressing and that you should be really excited because you're stepping into something that's going to change your life in just moments or hours, but we're not keeping track of time. Remember that. This one right here is a nice little dance. So we have partner and mom just holding each other at the hips. I also really like seeing moms bring their arms over maybe dad or partner's neck and just rocking back and forth. The reason why I like this position is because if you have a doula, the doula can be on your back, and the doula can be getting into your hips and squeezing, maybe with a rebozo around your belly. A rebozo is, actually, I have one right here. A rebozo is a long, very strong cloth, and this can be tied up all around mom to support her weight and alleviate the weight of the baby so that she can really relax into her position. So as a doula, I would be on the other side of you. If you're hanging onto dad's neck, I would be on the other side with the rebozo wrapped around your belly and pulling you from the back and lifting up. I would also be probably rocking and being very quiet so that you two can connect and that you guys have each other's pheromones right next to each other, and that you can cuddle into your partner's neck, maybe kiss. Kissing is so nice to really engage with everything that connects you, that created that baby, will help get your baby out as well. The next position is on your back. This one is really interesting. So I'll show you what I would prefer if you were on your back in the bed and you are raised up, right? So you're not completely flat. We don't want you to be completely flat. But if you're raised up in a hospital bed, say you had an epidural, that we would use something like a birthing ball that looks like a peanut. And the peanut could go in between your legs, and we can shift your legs from side to side. So even moms that have epidurals that are now basically needing to stay on the hospital bed, we can still create movement every hour. We can even shift it every half hour. But that rotation of hip never stops, and that we allow that baby's head to gradually just shift down, come down, be supported, and flow out. The one on the wall, have a lot of moms that like that one as well, and that's great for a doula or a partner, because we can get to the side of her and talk to her in her ear. We can look at her face, kind of peek under that arm, look at her face, and they'll see this all the time. Right there. I've got a nice little crease I will show you. I see this. Their eyes kind of tense up. Their face tenses up. Partners, go like this. Just touch them in between the eyes and they will relax. And all of that tension will drop down. And you tell her, relax your face. Relax your jaw. You are strong enough. You will get on the other side. Believe in yourself. Yes, you can. Breathe. Let it wash over you. Yes, you can. And you will feel her body release. Tell her to relax and give her a hug if she wants a hug. She might tell you, I need some space. And that's okay too. But let her know, I'm really proud of you. You really handled that really well. Your job as a partner is to validate all of her strength. She can't see it because she's so in the zone, but she needs to be reminded. So please tell her, you took that on so beautifully. You were so relaxed. I loved how your eyebrows tensed up and then you knew to just let it go. Your shoulders really relaxed through that one. Really nice job. When we tell her these things, these positive affirmations, she remembers them for the next time. She knows that she's strong enough to get through the next one. So partners, we need you to have a voice too. Start rehearsing some things, maybe in your head, have a conversation, go on date night, talk about things that you like to hear, things that you don't like to hear. Please don't say this. I had one couple that requested for her partner to not touch the phone because at the time Pokemon Go was really big and he was trying to find a monster. So she said, whatever you do while I'm in labor, do not go on Pokemon Go, which I thought was so funny. And it became a joke throughout the day. And so we would laugh if she ever mentioned, you better not be on Pokemon Go. And mom would laugh. And then when you laugh, you release. And those are great things. You can see some other positions right here. This chair is going to open up your hips really well, and it will support you so that you can put your head down. When you dilate, your eyes dilate. And so having a dim set room or being able to close your eyes, maybe having a sleeping mask on, something that allows you to really engage, to disengage with the light that is around you, sometimes allows you to just drop into your body, drop into your mind, and know that you're going to breathe this through. That wave is going to come over you and it will pass and you will step through it. You can do it also on your arms, putting your head down. That's a really nice tabletop pose, but with your arms elevated on this next one right here, a nice place for your head to rest. I love this position as well. This typically happens when I have moms that are attached to monitors, and we're having to get the reading on the baby consistently. And but remember, the monitors only have to get a reading every 20 minutes out of an hour if we are in a healthy state and that your doctor gives an okay. So if we can be away from the monitors and walking up the halls and walking around your room, dancing, please dance. As a spirited dancer from within, put on your favorite song, rock it out. It really helps shifting your hips around, getting positive adrenaline going, and just laughing and just having a great day of it. So those are great things. But if you're on the monitors, that means that you can still be on. And if you have not had an epidural, you can still have your monitors on, ask your nurse to help you, and sit on that birthing ball. A birthing ball is like one of those big, giant round balls, and I have a picture of it, and I'll show it to you. But if you sit on that ball in front of your partner, you can either be facing towards your partner with your legs, with your hips open and around their legs, or you can reverse and lay back into your partner. So right here, mom can actually lay right back into dad or partner's chest, and you're going to get that connection again of pheromones and just intimacy right there. Kissing can happen, soft talking, positive affirmations can happen so easily. I love that. You're going to see some other positions right here. This one is the one that I'm going to focus on right now because I think this gets used a lot in the hospital. When you're in the hospital, the toilet can be your best friend. Typically, if you want to get some space from your medical team or anyone else in the room, say you have relatives that stepped in and you cannot get centered, you can say, you know what, I need to use the restroom. And so at that point, if you have a doula in the room, that could also be her cue to clear the room. It can also be a cue for your partner to clear the room, that the visiting time is done. Mom needs to really engage with herself again. Using the restroom, you need to do it every hour, so it's a great excuse. Being on the toilet allows you to open your hips and you can rock and shift back and forth. I've seen some beautiful dancing on toilets before while moms are laboring. So I really like the toilet. It is also a place where you're going to, once your water breaks, and even before that, you're going to have fluids that are exiting your body. And so it's a nice place for you to feel dry and to just let it flow and to be okay with not sitting on the bed as that's happening. But also, if you are on the bed and you have fluids flowing, they do a really nice job of having some pads down on the bed along over your sheets so that it pulls the moisture away from you to keep you dry. This one right here is this bar right here that can be attached to the bed. So if you are really looking for that position where you want to sit on your hospital bed, put your feet up on the stirrups at the bottom of the bed, and then grab onto that bar and really crunch in, you can also ask for them to bring in that bar, and that will help you do that. Doulas really know how to assemble that if the nurse is not available as well. You can tie a rebozo to it and lay back and pull and have some body weight. Sometimes you'll see that through pushing. Some moms request that position as well. All of these are pretty self-explanatory in the positions that you can get. See that birthing ball and in all of these pictures right here. Partners, this one I want to focus on real quick. So this position is a great position. You can also take away that birthing ball and go all fours in tabletop position, moms. Partners, dads, you can stand straight with your knees at mom's hips on the outside of her hips. And as she's going through a contraction, just slightly just bring your knees together just a little bit to add a little tension, and it helps mom's hips open. And if you have that scarf, that sheet, or rebozo, you can swing that underneath mom's belly and have both ends right here. You can tie them together like this and pull just up a little bit and squeeze your knees just a little bit on her hips. And that alleviates the weight of the baby, and it helps open up her hips, and it feels really good. Even right now on the prenatal side, being at home, hanging out, watching TV, it's a great position to try out, and mom will be really appreciative of it. The last one right here is that hydrotherapy. So depending on what hospital you're in, some, if you're in a birthing center, will have tubs. When you go on your tour, and everyone must go on their hospital tour, I want you to ask questions like, do I have access to a bathtub? Does my water stay warm throughout the day? Or what temperature is my water at? Some moms opt out of having a tub because in the hospital, they only warm at one time, and then it stays that temperature for the rest of the day. Plus, you can't have your water too warm. You have a baby inside as well, so they want to keep your temperature at a really safe level. So sometimes moms will opt for a shower. Showers are a great place. We talked about this as well. Partners, bring your bathing suit. The last thing you want is hanging out in your skivvies in the hospital with nurses running around. All the attention needs to be on mom. So bring your swimsuit, be ready to jump in the shower to support mom if she wants it. Moms, you don't always have to have support. What I prefer is that you always know that you have support, that you always have hands available to be on your back or on your feet or holding your hand. This is also a nice little acupressure point right here. I tend to pinch mom's hands while they're going through a contraction. Right now, don't do it. But when you are going through labor and delivery, that is a safe spot. Right now, don't do that. But partners, if you pinch right there while she's going through her labor, it will help her focus. It feels tender, but something about it engages her, and that she feels supported and that you're holding her hands. Let me see what else I can talk about water. It's just a nice place to feel clean, to get refreshed, and get ready for the next position, or that you're getting ready to open and deliver. So water is a great thing. Just figure out how it works best for you. I will say a bath on the front end during early labor can do a couple things. It can calm you down and help you relax because you're going to get so worked up and so excited that it's just around the corner. That calming down and relaxing is a great thing to get some rest. Please also understand, though, that when you get in the tub, if you're looking for your labor to pick up and it relaxes you so much, it may slow it down. So it just depends. Where are you at mentally? Is it something that you need to calm down so that you can relax? Or do you need to get that momentum going? Do you need to be on your feet, walking a hill, dancing to a song? Do we need those contractions to pick up? That's up to you and your process and your body. And you'll know that when you're there. I wish I could really tell you at this point, when you feel like this is exactly what you do. Everybody's story is different. It will change, and you just have to have the education and the wisdom and the empowerment to know how to make that decision for yourself in that moment. Moving on. Okay, so right here, I thought this was a pretty decent picture of a nice place where thumbs are enjoyed for massage while going through contraction, really getting into kind of like that tailbone area. And it almost starts right at mom's butt line. You can really get into that deep, there's kind of like little holes, and you can press in and create that counter pressure so that when she's going through that contraction, she feels it and she can press into it, and it really opens up her hips and helps with just withstanding the surge that's coming over her. The other thing is, for comfort measures as well, I've also had moms hire an acupuncturist prior to labor and delivery and arrange for them to come into their environment to do some acupuncture to relax while going through labor and delivery at home. Now, your acupuncturist is typically not welcomed within the hospital setting, but ask your hospital, what are their regulations? Ask your doctor how they feel about it. There are other things like learning acupressure points, such as the one I just showed you with your hand. Don't do it now, moms. But when you're going through labor and delivery, that's a nice spot for you. But learning some of those acupressure points can really support you on the day of your birth. Okay. This looks delicious, so that's why I put it in. No, I want you to really focus on hydration and nutrition. So you're running a marathon, and as any marathoner knows, they need sustenance to keep them going. So I think the old school mind within the hospital system was that no food, only ice chips, and that's what mom ran on. But as studies are showing, and as a doula and the recommendations that we give, as well as birth educators, we highly recommend that you do have a form of nutrition around you whenever you want it. The thing is that there can be stuff like heartburn and nausea. And so you want to be careful with your system. I ask moms to not consume anything that's acidic, anything that's going to be a little bit harsh on the system. I have moms that really like smoothies because it's easy to access. So if you have that person who really wants to help out on the day of your labor and delivery, put them in charge of bringing you fresh smoothies, and you can sip and you can get some nutrients and some sugars and everything that's going to help you push through your day. Hydration, partners, fathers, stay on top of her drinking her water. And we'll talk about what to pack for the hospital next class, but just keep it in your mind now. Find a water bottle that has a great straw. They have containers at hospitals that have straws. They're fine. They're completely fine, and you can rely on that. But if you have a water bottle that you really like and it's easy for you to drink while sitting in a bed, sitting on a birth ball, in between contractions very quickly, then bring that. And you know, if you like it cold, keep it cold. If you don't and you like it room temperature, that's great. Just keep hydrated. And next going. And one thing that I have heard from nurses is even if the regulations at the hospital say don't eat, just tell your nurse. You don't have to hide it from her. And I've been taught to, if you want to hide it from your staff because they say don't eat, hide your food in the bathroom and no one will bother you in there. But I have had great nurses tell my moms, you know what? I understand that they don't want you to eat for certain reasons, like if there was a cesarean, but I just need to know so that if something like that happened, that I can inform the doctor that you did have something to eat and that they can just prepare for it. And I really appreciated that feedback from that nurse because they really supported the idea of mom continuing to nibble through the day and didn't want to shame her because they saw that it was beneficial to her process. And all that they asked was for communication. Aromatherapy. Keep it simple when you're packing. Don't bring a candle. Hospitals do not allow candles. If they did, that's a weird hospital. You might want to find a new one. But they do allow aromatherapy. So some like to get the aromatherapy kind of steamer. You can plug it in and the scents go. What I like as a doula and working with moms is having 2 scents. I like one that is very fresh and wakes mom up. And I like something that is very soothing. So we kind of figure that out on the front end. Moms, if you know yourselves and you know certain scents that you don't like, don't bring those. Some things that are pretty typical: lavender, jasmine, kind of soothing smells. Something that is really uplifting: citrus, tangerine, eucalyptus, kind of sets the tone for changing the energy in the room as well. Do not put it on your skin. If you have your partner helping you, put it on one of the paper towels that's inside of the hospital room and just lay it on the pillow by your head if you're in bed. If you're up and walking, you can kind of just tuck it into your gown, and all those kind of it will stay on around you, but if you get tired of it, you just crinkle it up and get rid of it, and you never have to smell it again. So that's how I feel about aromatherapy. Epidural, spinal, walking epidural. So everybody talks about the epidural, right? And this is a comfort measure. Now, if this is something that you absolutely do not want, you can tell your staff, please never mention the word epidural around me. If I want it, I will bring it up. And they will respect that. But you do have to inform every nurse. As I said, all the nurses, when they are changing guard, don't always transition with all of the communication that you handed off to the first one. So just tell them, I don't want to hear the word pain. I don't want to hear about an epidural. If I have any of that, I will tell you. Please keep me in a calm state, help me relax, and focused on what I need to get done. And that's breathing, relaxing, and releasing. With your doctor, have a conversation about epidurals. What's the difference between an epidural and a spinal and a walking epidural? Nowadays, when an epidural is given, a mom has the ability to, it's given at a certain level, and then she has the responsibility on her own to click a button if she wants more. And if she doesn't want more, then she doesn't click the button, and she can have sensation, and she can feel at the level that she wishes the sensations that she wants that's going on with her body. But have that conversation with your doctor, what they recommend if you are choosing to have an epidural. The other piece is that when we're looking at an epidural, the recommendation is to get yourself to active labor. So that would be 5 centimeters or above for active labor in asking for the epidural. I've also heard that anything between 6 and 8 is a great range because it can run out, because we don't want to slow down the progression of your labor. We want you to be in active labor, and that maintains and goes forward. When it happens too soon in early labor, it really stunts the progression of the contractions. So the later that you can push it back, the safer it is, and the more success that you'll have with without having other medical interventions. And oh, I missed it. Okay, so now I am going to welcome on the screen, and let me just fumble around right here. First, I'm going to tell you about this cute little baby right here. She is near and dear to my heart, part of my family. And she was going through some issues when she came out into this world. And mom and baby really needed some support. And I had just had a conversation with Dr. Kayla Ambert, and I'm going to invite her on the screen right now. Yes. Okay. Currently inviting. We had just had coffee together, and I let my friend know that she has amazing services that could really support them. And weeks later, they ended up in our office, and now you're seeing her getting worked on by Dr. Ambert. And it's just been a really nice support system for both baby and mom. That's just one scenario of what Dr. Ambert does, but I have her entire bio over here. The greatest thing about her bio is if you read into it, there is a free option for you if you're in the local area of San Diego. So if you're tuning in this evening or watching it after it's been recorded, for class 3, if you've attended, Dr. Amber will provide a free prenatal consultation and assessment, ensuring pelvic alignment for ideal fetal positioning. How cool is that? It's awesome. So, Dr. Amber, thank you so much for joining.
Yes, of
and
course.
I just want to start out with how did you find the passion in the work that you do? What put you on this road to this practice that you've built?
Yeah. So when I initially started practicing, I actually got involved with prenatal care, and that led me into working with children. And I actually started working with terminally ill children, which we really wouldn't think, oh, I'm going to see the chiropractor for my medically fragile child. But my colleagues saw profound results with just very gentle, light, but effective adjustments. And these kids who were on heavy duty drugs were having, hours of, giggles and relaxations and time with their family that was enjoyable and not in stress. So that led me down the pediatric path. Prenatal care and pediatrics go hand in hand. So that's where I am today. And I'm grateful for those little ones who got me here.
Aw, that is, I just adore your energy when talking with you about the work that you do. You are engaged and so passionate about your clients. It just exudes off of you. And so I had to have you on for this series. And now I'm going to get to the hard questions. So the first question, as a chiropractor, can you elaborate on what making room and making space means for a mom on the prenatal side and why that's important?
Yeah, great question. Because space, like what is the space, right? So this is the space, right? This is where a baby lives. Like this is their home. So we're going to talk about why that's important, not only for mama, but for baby, right? So I like visuals, so I'm going to be bringing lots of visuals. This is a great visual, right? And so if you look at this visual, this is a mama who has less space, and this has a mama with more space, right? So when we talk about mama, breathing, her breathing will be helped by increasing space. Other things like stabilizing the new weight will be helped by increasing space. Different things like posture, right, will be improved by by increasing space, right? So increasing space is going to be important for mama, right? But it's also really important for baby, right? So I'm going to bring
your pelvis is so much more realistic than was from class 1. My pelvis was very tiny.
Well, I have these like little screws in here, and people are like, is that really there? Like, no. So this is where baby lives, right? And so this is why we want to create as much space as possible. They have very little space to grow and develop. And we want to make sure they're able to move and explore and be able to shift from side to side, move that elbow, stretch that arm. And if we don't have that space, they're pretty crammed, right? So we want to make sure they have the maximum space to grow, develop, and eventually, most importantly, take that duck dive into the proper fetal position so that you and baby can have the easiest smooth birth as possible, right? So now that we know it's important, how do we do it, right? So the biggest concept I want everyone attending this to understand is it's motion. Motion's going to help you keep that space and room as maximized as possible. Okay, so things like everything we do on a daily basis. So sitting. Sorry to be the bearer of bad news, but we want to avoid it as much as possible, right? So let's replace it. Rather than sitting in a chair, let's replace it with an aerobics ball, right? That way we can sit, we can relax, but we can still keep the motion, right? We're moving, we're bouncing, the pelvis has got some motion, right? Instead of sitting in a lazy boy or a couch, let's choose a rocking chair, right? We're going to be using the rocking chair for those late nights in a couple months. Let's start using it now to rock the pelvis, right? You can sit and watch TV or relax in a book, but keep moving. Keep that pelvis moving. Because as soon as that pelvis gets stuck, or as soon as this pelvis gets stuck, right, the surrounding soft tissue start to spasm and bind to protect it, right? That's good, but it's bad because baby has less room to move, right? As soon as it gets stuck, our baby is going to be impinged on one side or another, right? So we want to keep it moving and reduce the stuckness, right? So another way we can get the most amount of room is through our posture. And that's hard because we have so much more weight, right? It's so much more difficult to walk around or stand upright. But keeping the pelvis tucked, right, from a neutral position to an anterior tuck will help us sustain the additional weight, and especially that underbelly weight, because that's where I find we have most pain, at that round ligament area, at the pubic symphysis area, because all that underbelly is being stretched and strained. So if we can tuck the pelvis, right, that way we can sustain that belly weight and we can lift our sternum. We can create more space in the upper area so you can breathe and baby's not punching you in the stomach or into the liver, right? Finally, to get space, get adjusted. Getting a prenatal chiropractic adjustment gets to the actual joint, right? And these are the joints that we want to focus on, which are our sacroiliac joints. And I think you were kind of pointing it to it earlier when you were talking about the acupressure.
Yes, please.
Yeah. The divots are real. Yeah. Those are real places. These are our divots, right? Into here, our sacroiliac joints, right? And the divots are right to the middle of it, where our sacrum is, right? These are key points. These are where our parasympathetic nerves live, right? And our parasympathetics are going to help us with birth. So these sacroiliac joints start to get tight or tense and become misaligned if we sit for too long or the pelvis gets stuck because of lack of motion. So a prenatal adjustment will adjust this bone back into alignment so we have the motion and baby has space. Right?
Such a good demo. So good.
Trying here. So those three things are the best ways that you're going to be able to maximize space, right? Staying in motion, keeping ideal posture, and checking in with a prenatal or a Webster technique or Webster certified chiropractor. The Webster certified is important because they're the ones that are going to really focus on making sure the belly's balanced, right? So they'll do a little soft tissue work with the psoas, with the round ligament, with the pubic symphysis. So you really want to find somebody who's Webster certified to get you under care.
So when looking for chiropractic support, what are some fears that people have around it, and how do you kind of meet mom or mom and baby where they're at to allow them to understand that this is not something that's traumatic to the body, but really supportive?
Yeah. So many people have the idea that all chiropractors are crack and pop, right? And so that's actually a style, a technique. It's not just everybody. It's called manual adjusting, right? And it has its benefits, right? But there's other techniques out there. It's not the only one, right? So I personally myself, I use a technique called activator, and it's a tool that's very gentle and you barely even feel it. It's like a little thump on different areas, but it doesn't require any twisting or torquing, right? And usually the twisting and torquing is the most fearful part of it, right? Moms are like, well, I don't want to be twisted around with the belly, right? So there's definitely a lot more safer and less invasive approaches out there. Also, laying on the belly. Moms are like, how can I lay on my belly? Like, I've got a baby. There's certain tools and pregnancy pillows and adaptive tables we use for moms, right? Oh, nice. So I actually have moms who are asked to, rent out the hour so they can lay there on their belly for an hour. So it's actually a nice, enjoyable, relaxing time for the baby and the mom. Because when we do Webster technique, we're connecting and the baby starts moving and shifting from one side to the other. And they're like, holy crap, what's happening? Yeah. So it's a time for everybody to connect, enjoy the moment. I know you're a big proponent of that because this time is only temporary. And so it's really important to enjoy those special little moments.
Yes, definitely. Okay, so from your experience with adjustments, can they support spontaneous labor? say I have a mom who's getting into that week 40, 41, even 42, and approaching 42 and really wanting that spontaneous labor. Can getting adjusted support that natural induction process?
I say yes with a grain of salt, because there's no one-to-one equation here, right? I'm not going to adjust you to get that baby out of here. I'm going to adjust you with one purpose, right? And my one purpose is to make sure that your brain and your body are connected. If there's a disconnection because a vertebrae is out of alignment, right? The brain can't speak to the uterus or to the muscles, the pelvic muscles, to get things going, right? Once we remove this discommunication, the brain and the body can now communicate, and that is restored, right? And so that's why we see spontaneous induction with chiropractic adjustments, because now the body's like, oh, we got things to do here. We've been backed up for a week now. So just letting the body do what it naturally knows how to do is my goal. Right?
Yes, that's great. Thank you so much for that. Another question for you. Looking at that transition of trimester 4, postpartum, how can, when we're looking at healing for the body physically, how can adjustments support, what are some of the things that you see moms come in on the postpartum side that really get in the most benefit of the adjustment?
Yeah. So we all have a different experience. We all have a different birth, different children, different experiences. So healing and recovery, I preach. So I'm so glad you brought this up before the baby's here, because we do have to think about it. And it is scary because our bodies are changing so much and we have no control over it. And I think that's the most difficult part, is that we want some control over the big, the small, the shrinking, the loose, the not loose, right? So I try to encourage my patients to have control in the knowledge and know what's going to happen or know changes that happen. So I encourage my mamas to come in whenever they're ready. They can be ready the next day. They can be ready in 2 weeks. It really depends on them. But I assess the spine the same way I would if you weren't pregnant, except we have a couple extra spaces or areas like our pubic symphysis, right? Our sacrum into that coccyx area, right? And a couple other areas. If these areas become misaligned because of birth, right, it will start to irritate the attached soft tissue. And more importantly, we'll see a lot more diastasis recti and weakness of the core and the pelvic muscles, and other things like incontinence and sex issues later on. So getting the structure, your foundation aligned in those first couple weeks can be so critical to the overall healing we see in the next year, right? All of our tiny little ligaments, muscles are attached to these bones. And if they're kind of torqued or twisted because of the very intense and physiological difficult thing, then they're going to heal in that misaligned position. And therefore, one side of the core is going to be tighter than the other. One side is going to be weaker. We're going to have chronic pain at these SI joints, right? So it just kind of leads down a nasty cascade that we can completely avoid with very gentle and effective care. So when it comes to postpartum, I preach, heal and recover, and really take that time to let your body come back to you, because it wasn't yours for 9 months. So
Exactly. Okay, so mom seeing you postpartum side, is it something in your practice? Now I'm asking this question, but I already know what you're going to say. Do you have babies that come and see you for adjustments as well? And what kinds of things are you seeing come through your office with moms with babies in arms looking for answers?
Yeah, well, I love babies, not just because they're so cute, but because they're a whole different realm. I love everybody and I love all my patients. But most of us come in as adults with, like neck pain or back pain, right? And pain's important. But when a baby comes in, it's not because they have neck pain or back pain. It's because they're having dysfunction. Something in their tiny, cute, adorable body's not functioning right, right? It could be an organ, it could be a muscle, it could be a tendon, a ligament, all these different things, right? Things like gut dysfunction, like colic and GERD and reflux, things like breastfeeding issues like latch and tongue tie, sleep disturbances, torticollis, just a range of different things that I can, again, not put a one-to-one equation on, but I know the nervous system takes care of all these things, right? The nervous system is in control of all the things we do think about and the things we don't think about, like digestion and breathing and balance, right? So when I see a baby, I check their tiny little bodies and I check their little sacrums. Usually that's the area we have when there's constipation or we have some sort of gut dysfunction, right? And so adjustments for a baby is very gentle. And then I check their little atlas up here, right? And usually I find if a baby is having some sort of colic or tongue tie or latch issues, that this top bone has shifted one way or another, right? And why would that happen? Now, they were just growing and developing in a very tiny space, right? And then they went through a really tiny little canal, right? So if it was difficult for mom, it most likely was difficult for baby, right? So oftentimes through that physiological and emotionally stressful time, these bones can get torqued and twisted and the baby can kind of have a little kink, right? And so all I do is I take my little fingers and I use the pressure it takes to check if a tomato's ripe. And I put that pressure in there and that bone slips properly back into its right position, right? It doesn't take force. There's no cracking, there's no popping. It's very gentle and it's very non-invasive, right? Some of these kids are, their next steps are surgery or drugs or other types of interventions that can be easily avoided through just gentle and effective adjustments. So again, things like colic, reflux, GERD, constipation, tongue tie, breastfeeding issues, sleep disturbances, all of these things, you know, and as they get into toddlers and older, you know, it's things like eczema and bedwetting and all these things that we don't think about, but our body is still in control of doing, right? So again, the bottom line is allowing the body to do what it knows how to do, but sometimes it needs a little assistance.
And that's where you can help. Yep. Okay, I have one more question.
Got it.
So kind of pulling from your other expertise in nutrition, what are foods that you recommend for mom? Now we're talking about this year-long postpartum year of healing. What are some foods that you recommend or things to implement within a mom's diet to help her heal within?
So the first thing that I preach is probiotics, and starting this pre-postpartum, during your pregnancy, if not before, because know that your gut is going to be your baby's gut. So if you know that your bowel movements are not as they should be, and if we're having gut issues already and cramping and bloating and gas or our own reflux or GERD, you know your baby's going to have those issues too. So start now by getting rich probiotic foods, whether you want to make your own kefir at home or you're going to buy sauerkraut, whatever works for you, but get actual probiotic rich foods. If you can't do the foods, supplement, but I really encourage food first. Okay. I can't preach that enough because I'm seeing just an overload of kids with these issues and it's very probiotic driven. And many of us moms have to be on antibiotics for one thing or another during our pregnancy. So we do want to replenish those good bacteria that are important for ours and our baby's health, because our probiotic health reflects our immune system. So mom's immune system, baby's immune system. So that's the first thing. The next thing is good fats. I'm a big proponent of fats, especially during pregnancy. We know half the brain's made of fat. So we definitely want to be getting things like avocado, coconut, tree nuts. If you eat animal meat, get clean, lean animal meat, fish. Other oils, olive oil, try not to cook with olive oil, but actually use it in your dressings and things like that. That way you can maximize those polyunsaturated fats. Other things are green leafy foods. Green leafy foods, everybody likes, yeah, eat your greens. But we have these very important minerals like zinc. Zinc is so important to the healing process, especially during postpartumhood. And we override these very critical nutrients. So zinc, manganese, other important tiny minerals are found in these green leafy vegetables. Last thing is raspberry leaf tea. This is good for the reproductive system, and it's good for postpartum healing. Our reproductive system just went through a whole lot of changes, so we want to help bring it back to its normal balance, right? We have fluctuation of hormones. We have changes in our internal organs, right? So we really want to provide it with nutrients that are going to create those healing effects, right? And then overall, sorry to say, but avoid the sugar, avoid the excess dairy.
Yeah,
I know. Don't kill yourself. Have a glass of wine. Indulge, but indulge in the right things, because know that everything that you are eating is what your baby's going to be getting. So if you know it doesn't feel good on your gut, no, it's not going to feel good on baby's gut. So just know what you do is what the baby will get.
awesome. Is there anything else that you would like to add that maybe I didn't ask you?
I guess maybe when I was talking about motion, people are like, well, what kind of motion do I do? Just walk a lot? Or no, I don't want you to walk a lot. I mean, walk, but don't go for like a 10-mile walk uphill. Be reasonable. But you can do motion in different ways. You can do it standing. You can do it on an aerobics ball. You can do it in a pool. That's great if you're having terrible low back pain. That will help those SI joints. But two motions that are really going to help sustain the weight as well as engage the core and strengthen the core are the first one's pelvic tilts, right? And I'll show you that. So this is the neutral position. And to do a pelvic tilt, you're going to engage these cute little glutes of yours down here in your lower core. And you're going to go from here to here.
Okay.
There to there. Right? Remember, it's a micro movement. It's a small motion that's going to make a big difference. So you can stand onto a back of a chair. I'll demonstrate. Oh, you can't see my pelvis, but you're going to just do pelvic tilts, right? Pelvic
you
tilts.
can see it. Yeah.
Okay.
That's great.
Right? So that's a good way to keep in motion, even during active labor, like you're showing those different positions, right? The second one is figure eights. So that's a little bit more understanding, right? You want to make a shape of an eight, right? Eight, right?
Yes.
So these are little tools that I tell all of my patients, start doing now, right? You need to start creating these micro movements to keep the motion in the pelvis and start engaging the core, because you're going to use that core. It's going to be beneficial. So training for the marathon that you're about to endure is a part of pregnancy. And you can do those things through tiny little micro movements, avoiding sitting excessively. And really keeping that motion throughout the day.
Great tips. And thank you for the demo as well. It was superb. And you're just a wealth of knowledge, and I cannot thank you enough for coming on and helping us and supporting all of our families to empower themselves with their own education, so that they know that they have the resources and the choice as they go through this big adventure. Yeah. So signing off with everyone. Thank you, Dr. Amber, for coming on tonight.
Thank you, Christina.
If you have any questions, if you have any questions, always tribedoula@gmail.com. And all of Dr. Amber's social media website is attached on the comments bar. So if you'd like to get a hold of her, you can contact her directly or just email me and I'll get you guys together. All right. Have a good one. Till next week. Bye.
Bye.